Depression is a very common disorder and clearly has a major impact not only on the patients, but on patients' families and on their entire social structure. And I wanted to say a few words about that because untreated depression can really be very disruptive. Patients who are depressed typically become more withdrawn. They don't want to go out. They find it hard to make decisions. They become a little bit more apathetic, if you'll forgive that word. And this throws an enormous burden on the family, particularly the spouse. If patients don't want to go out, then many spouses will remain at home with the patient, which therefore means that both of them become socially more withdrawn. After a while, often the spouse will become increasingly angry with the patient. Here's a patient who can't make a decision, for example, who has no interest in doing anything, doesn't want to meet friends, is withdrawing from life, can't even decide what they want to eat for dinner. This becomes an increasing irritation to family members and spouses. Spouses who have been loving and affectionate and very caring of their partner find it increasingly difficult to cope with such issues, particularly when the patient themselves may not recognize that there is a problem, which again is all too common. So that what happens is that the family may become increasingly withdrawn from the outside, and within the family, the patient becomes increasingly isolated from the rest of the family. And this then becomes an increasing burden for everybody. Indeed, very occasionally, there may even be spousal abuse or abuse within the family because people become so impatient. This is one of the reasons why it really is important for treatment to be offered early to the patient who is depressed. As I say, many patients with depression have only a mild form of depression, but nevertheless there are some, 10, 12% maybe, who have much more severe depression. And in these patients then, the entire family structure can be disrupted. In a disease such as Parkinson's disease, the support structure of the family and of one's social circle of friends and acquaintances and so on is really very important. And to lose that support structure because of depression can be a major additional problem in managing patients successfully. So that I would then urge any of you who might feel that you have depression to discuss this with your physician, because it will help not only you but the family for the depression to be adequately treated.